coders, good morning, good evening, good afternoon, all depending upon where you're joining us from. Welcome you all to the Solving Case Studies for Medical Coding Exam Group Study sessions by AMCI. So, how are you all doing, coders? Let me know in the chat. How do I sound? Great, great. Okay, coders, happy Tuesday, and welcome once again to the week 2 group study classes. The purpose of this group study session is to review the scenarios that will prepare you for the medical coding board exams. Yeah, so after successfully completing the week 1, we are here back with the week 2, and we have got a lot of great topics and great scenarios for you all today. So without wasting much time, let me move on and let me get this group study started. Okay, so the steps to solve the medical coding exam case study is one of the steps which we follow is to select the code that best matches our inventory. How to solve a multiple choice case study scenario for the board exam. We here at AMCI follows few steps. These are those steps. We highlight the keywords. We use yellow color for the diagnosis. We use green for the procedures and pink for the inclusive procedure. Document your inventory procedures and diagnosis and then select the primary. Review the guidelines. Select the code that best matches your inventory list. Now you're going to hear that a lot during these group studies. So when highlighting, keep in mind that do not highlight the following: the things that are observed by the physician, the closures, the sutures, staples, etc. Most cases such as bleed control, drains, irrigation of the surgical site, installation and removal of clamps and trocars, dressings, the surgical rigs. So we won't be highlighting all these. So we have with us our AMCI Curriculum Director, Mrs. J. And that's me, Mr. Sandeep, your instructor for the group study, joining you all the way from Abu Dhabi. And it is time to introduce the intern. Yes, we have with us Miss Katoya. She will be there interacting with you all in the chat, encouraging you and also helping me with some of the scenarios. Let's welcome Ms. Katoya as well. And goals for the presentation for the week 2. What are we going to review during the week 2? We are going to review the cardiovascular system scenarios, digestive system scenarios, and urinary or male system scenarios as well. So let's get started with cardiovascular system. So coders, are you ready for cardiovascular system scenarios? Let me know in the chat. Okay, great. So let's make this study session an interactive one, and we will be responding to you in the chat as well. So if you have got any questions, please put in the chat and we'll be addressing them. Okay, so I will start the proceedings. I will read the first scenario for you all. Your options are option A 33465 33530 T82.6XXA I07.9, option B 0545T T82.6XXA I07.9, option C 33460 33465 T82.6XXA I07.9. Option D, 33465 T82.6XXA I07.9. The preoperative diagnosis is prosthetic valve endocarditis. Post-operative diagnosis, same operation. We have replacement of a 10-year-old tricuspid valve using 31 Carpentier Edwards pericardial bioprosthesis procedure. The patient was brought to the operating room, and after having appropriate monitoring devices placed, he was intubated and general endotracheal anesthesia was achieved. The patient was prepped and draped in usual sterile fashion. The chest was entered via median sternotomy incision. Simultaneous to this, right common femoral vein was dissected. The pericardium was opened. The patient was given systemic heparin and the ascending aorta and the superior vena cava were cannulated. Similarly, right common femoral vein was cannulated. The patient started on bypass. The caval snares were placed and the right atrium was opened. An intra-arterial thrombus excised and cultured. Prosthetic valve was excised the place. The right atrium was open. The prosthetic valve was excised and the annulus was debrided and irrigated. The valve was sized and a 31 valve was selected, placated 2-O bond sutures were passed circumferentially around the annulus, ventricular-atrial fashion. These sutures were tied and valve was inspected. The valve was found to be well seated and the atrium was closed, running 4-O proline sutures. The patient was rewarmed, de-aired, and then weaned off from bypass with low dose inotropic support. The temporary drains were placed and the mediastinum was policed for hemostasis and sternum was reapproximated with stainless steel wire. The femoral vein and the groin's wounds were closed with layered vicryl sutures. The patient was taken back to cardiac surgical unit in a stable condition after tolerating the procedure well. Okay, Codes, that was first scenario, and that was a bit long scenario as well. So we'll be having few more scenarios, long scenarios going for it, and you've got 2.5 minutes to solve this one, and your time starts now. Okay, coders, that is time, and let me have a look into the chat. Okay, how are you all doing? I can see only a couple of answers in the chat. How about the rest of the students? Okay, coders, please go ahead and give your best answers in the chat. Don't worry if you get it wrong. You can always give your best answers. Yes, it's only me and Miss Katoya is seeing your answers, so no one else can see your answers. And even if you get it wrong, we are all here to learn something, right? So it's going to be an aha moment if you get it wrong. So don't worry at all. Please, give your good best answers and give your maximum participations. Okay, I will wait for 5 more seconds and then I will start explaining the scenario for you all. Okay, great. Okay, Gaurav, so let me walk you through this scenario. So first of all, let's highlight the keywords. We have prosthetic valve endocarditis in the scenario, and the procedure performed is a replacement of a 10-year-old tricuspid valve. Patient was intubated, endotracheal anesthesia was given, a stenotomy incision was made, a right common femoral vein was dissected, pericardium was opened, ascending aorta, superior vena cava cannulated, common femoral vein was also cannulated, and patient was started on bypass. A prosthetic valve was excised, valve was sized, and 31 valve was selected, and circumferentially passed circumferentially around the annulus. So that's all what we have here. And in the procedure inventory, the step number 2, we have to get our inventories correct. So the procedure inventory, we have a replacement of a 10-year-old tricuspid valve, and in diagnosis inventory, we have prosthetic valve endocarditis. So what do you mean by endocarditis? Do you have any idea, coders, what an endocarditis is? So an endocarditis is an inflammation of the inside lining of the heart chamber and the heart valve, which is known as an endocardium. Yeah, the layer lining is known as endocardium. So inflammation of the endocardium is known as the endocarditis, and the prosthetic valve endocarditis is a one type of endocarditis that will affect the replaced prosthetic valve. So once a patient will have prosthetic endocarditis, it will cause the valve to damage, and that will lead to malfunction and causes further major complication. So in our scenario, the patient had a prosthetic valve, endocarditis, and a replacement of a tricuspid valve has been performed. So now let's come back to our coding portion and let's have a look into our options. So here we have option C, that is coding for 33460. Let's have a look into the code for 33460. So 33460 is coding for a valvectomy of a tricuspid valve. Next, we have to select the code that best matches your inventory. So let's cross check with our procedure inventory. So in procedure inventory, we're having a replacement of tricuspid valve and not a valvectomy procedure. So that means option C is incorrect. It's not matching with our procedure inventory. Now let's look into the next option. Option B, that is coding for 0545T, which is a tricuspid a transcatheter tricuspid annulus reconstruction using a percutaneous approach. So we have a open procedure performed. So looking into the documentation, we can see a sternotomy incision was performed, right? Yes, we had a sternotomy incision performed, which means this is an open procedure and not a percutaneous procedure. So that means option C, B is also incorrect. Now we have left with option A and option D, and I can see most of the answers was between the option A and option D. So let's have a look. Option A and option D are having a 33465, which is coding for a replacement of tricuspid valve cardiopulmonary bypass. And yes, that was the procedure performed. We had a replacement of tricuspid valve, and there was also cardiopulmonary bypass given to the patient as well. And option A having one more code, which is 33530. So let's have a look into what 33530 is coding for. 33530 is coding for a pre-operation coronary artery bypass procedure or valve procedure more than 1 month after the original operation. So now let's come back to our procedure inventory, and we can see that there was a replacement of a 10-year-old tricuspid valve. So whenever a reoperation of on a, or of a valve procedure has been performed, which is more than 1 month old, we have to give the add-on code 33530, right? So yes, so it is appropriate to code 33530 with 33465 in our scenario, and that will eliminate option D. So the correct answer is going to be option A, 33465 33530 T82.6XXA I07.9. How are you feeling, coders, after the first scenario?
Thanks for tuning in, and until next time, happy coding!